a stroke really is that it's a brain attack. So in other words, it's something that blocks the blood supply to part of the brain, or a blood vessel bursts. So it's your brain's equivalent of a heart attack. Now, damage to the brain from interruption of its blood supply is what happens, and a stroke occurs when that blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it bursts. So there's two different types, ischemic and hemorrhagic strokes. And the ischemic stroke is inadequate blood supply, normally when there's a blood clot or a thrombus, and then the blockage disrupts the flow of oxygen. Hemorrhagic stroke, on the other hand, is rupture of a blood vessel. So in terms of young people, what we classically see is that the health conditions that cause stroke, firstly, most importantly, is that stroke is very common, more common than what we think in young people. So around 10 to 15% of strokes actually occur in children and adults. The signs can vary, obviously, according to where the stroke is in your brain, but it could cause balance, eyesight changes, headaches, speech, and all those signs should be investigated. But what we usually refer to is the classic fast signs of a stroke. And those are, F is for facial drooping. If one side of the face is drooping and the other isn't, they may have suffered a stroke. Arms, if you can raise, does one arm drift downwards? If you can raise both arms, and then that may also be a sign. And then speech, the S in FAST stands for speech. Is the speech slurred or jumbled and mumbled and hard to understand? And then finally, the T is for time. So the time since onset